Welcome to Arthritis Now. I'm your host, Kyle Langen, and today's interview is going to be with Dr. McAdams-Demarco of Johns Hopkins, who is studying gout. Dr. McAdams-Demarco is the first collaborative grantee between the Arthritis National Research Foundation and the American Federation for Aging Research. Hi, Dr. McAdams-Demarco. Thank you so much for being on Arthritis Now with us. We really appreciate it.
Well, thank you for having me.
So I know your research is in gout primarily. Could you explain to those who might not know what gout is?
So most people are surprised to hear that gout is actually another form of arthritis. We often think of osteoarthritis or rheumatoid arthritis, but gout is a very painful form of arthritis. Patients that have gout end up having very sudden, severe attacks of both pain and swelling and tenderness all around their joints. And this occurs because there are urate crystals that build up on the joints that cause swelling. So if you can imagine like a rock candy and how crystals form with rock candy, that's in essence what's happening with urate crystals inside of the joint. And that leads to a lot of painfulness and tenderness and swelling. And this is all due to high levels of uric acid, which builds up in your blood and then deposits in the joints.
Can you explain what that is, just for people who might not be aware of it?
So uric acid is something that occurs in your body when you produce uric acid when you're able to break down purines. And these are substances that are found both naturally occurring in your body and as well as in foods. So we know that alcohol intake and organ meats and shellfish and other seafoods all lead to an increase in purines. And when your body breaks that down, you have an elevation in uric acid.
And then the buildup is what kind of causes that gout to...
Yep, and it comes both from external factors like your diet, but also just from the natural breakdown of purines that are found in your body.
I know that there's some kind of correlation, or people are trying to study if there's any socioeconomic factors that relate to gout more. Is that true, or can you do anything about that?
That's actually very interesting because that's some of the new work that we've been developing over the last year or so. I've been working with a doctoral student to better understand socioeconomic risk factors for the development of gout. And what we've done working together is look to see what types of markers of socioeconomic status are associated with the development of gout. And we found that adults who have a manual occupation, so they work with their hands or on their feet, during middle age are at increased risk of the development of gout when they're older. And in fact, this is particularly strong for women. So if women have a manual occupation, they end up being at a greater risk of developing gout than those who have other forms of work.
Can you explain what your research currently is in a broad sense, what you're working on?
Yeah, we are interested in really understanding the many different risk factors for gout. So what is it that leads an older adult to develop gout? And we're also very interested in what happens after a patient develops gout. So what are the consequences? One study that we've just recently published looks at the consequences of both gout and hyperuricemia, which is high urate levels in your blood, kind of a precursor to the development of gout. How do these two factors influence an older adult's physical function, so how well they move? We found that older adults with a higher urate level or those who have gout are much more likely to develop worse lower extremity function, but not necessarily upper extremity function. So what this means is that if you have gout, you may have a harder time walking, standing up, or sitting down, or balancing as you become an older adult.
Is there, I know you kind of briefly talked about it, but does age play a part in the onset?
And again, this was another area that really was poorly understood. Most of the work that's been done so far studies gout in either populations of all ages or in younger adults. So through this grant, through the Arthritis National Research Foundation, the American Federation on Aging, we were able to show that as you get older, you're much more likely to develop gout. So by the time you're aged 65, the cumulative incidence of gout we found to be 8.6% in men and 2.5% in women. By contrast, by the age of 75, the cumulative incidence rose to 11.8% for men and 5% for women.
Why did you choose to go into gout research? Was there kind of any kind of a personal connection for you, or was it just something you were interested in?
It stemmed from my doctoral training in cardiovascular disease epidemiology. There's such a tight connection between cardiovascular disease and gout, yet so little is known about gout. And in fact, gout is one of the oldest diseases. It's been known and recognized since the ancient Egyptian time, and yet we really aren't doing much research in that area. So I felt this was a great opportunity to take my training and understanding of cardiovascular disease and help apply that to a field that was understudied, mainly gout epidemiology.
Yeah.
We definitely think that moving forward, there's going to be a much greater burden of gout as the population ages, as there's more chronic conditions that are being developed in older adults. And we really want to think, what can we do to better help stem the tide of this rising public health challenge of gout?
Thanks for watching part 1 of our interview with Dr. McAdams-Demarco. Don't forget to subscribe to our YouTube channel, and if you'd like to find out more about the foundations that supported Dr. McAdams-Demarco, click on the buttons to my right.